Lung cancer is the second leading cause of all deaths in the U.S. According to the Lung Cancer Alliance, smoking is by far the biggest risk factor, causing at least 80% of lung cancer cases in the U.S. Since November is Lung Cancer Awareness Month, we now have joining us family nurse practitioner Kanaya Church from Bon Secours Suffolk Medical Associates, and she's here to talk about how to reduce that risk by quitting smoking. Thanks for joining us today.
Thank you so much for having me.
When we think about quitting smoking, after you're done, it's still going to have an effect on your lungs. That's correct?
Yes. So in the first few weeks of quitting smoking, your lung function will start to improve. You'll notice that you'll be able to take deeper breaths, as well as you won't get winded as easily. Every day that you're able to go without a cigarette, you decrease your risk of developing lung cancer. And at 10 years after quitting, you have decreased your risk of dying from lung cancer by half.
Wow.
So for every day that you can go without a cigarette again, you're decreasing your risk of developing lung cancer. And
so what you're saying, though, you're going to feel those effects like immediately. The minute
Yes.
you start, you just stop.
Yes.
And then it's going to have lasting effects.
Yes, it's going to have lasting effects for you quitting. So
It'll only be positive.
yes, all positive effects, all positive effects.
All right, now, the quitting process isn't an easy one. What are some of the things people can expect when they're trying to kick the habit and put them down?
So when you're trying to kick the habit, you're right, it's not an easy process because cigarettes contain nicotine. Nicotine is addicting, meaning that your brain is going to crave it. So you can expect headaches, maybe you'll be even a little grumpier. Sometimes people experience muscle twitching.
Ooh.
But what you'll also notice is you're going to have more time, you won't cough as much, and your sense of taste and smell will likely improve.
And we hear a lot about e-cigarettes these days. It's kind of like a trend. Now, is that an option? Is that going to help you?
Well, e-cigarettes contain nicotine, which can help you avoid most of the negative side effects of quitting. Also, e-cigarettes don't contain tobacco, so you may be able to experience some of those good benefits of quitting that we talked about. But e-cigarettes keep your body addicted to nicotine, so they're not going to be a long-term alternative to quitting. Also, e-cigarettes are not regulated by the Food and Drug Administration, and that means that they could have harmful chemicals in them without you knowing it.
Right, so it's an alternative, but it's not necessarily better for you. In the long
Right,
term.
not necessarily better for you. It's an alternative, but it's not going to be a long-term alternative.
What about medications, patches? We've heard about those. Is that going to be enough to do it?
Well, the first thing you want to do if you are interested in quitting is speak with your healthcare provider. Nicotine patches and gum are an option, but they're not going to be enough to help you beat your addiction. So as your healthcare provider is going to have access to other medications that can help you.
So, in your expertise of things, the cases you've seen, what's really the best way to go about stopping smoking and improving your health?
So the best way to go about quitting smoking is to use a few tactics, and that's going to include prescription medications. I talked about nicotine gum and patches. Also, you may ask your healthcare provider to refer you to a therapist so that you'll be able to deal with the stress and the cravings and withdrawals that you may experience with quitting. Also, if you attend a smoking cessation class, you're more likely, twice as likely actually, to be successful quitting. And as always, we always let our patients know that they can call 1-800-QUIT-NOW for quitting resources, and also use smokefree.gov for quitting help.
All right, well, those are some great tips and advice. Of course, it's not an easy thing for someone who's been doing it for a while, but it's never too late to start. To schedule an appointment with Kanaya Church at Bon Secours Suffolk Medical Group, you can call 215-APPT or visit goodhelpdocs.com. Thanks for joining us today.
Thank you so much for having me.